So varicose veins are bulgy, wiggly, distended veins that appear usually on the lower part of the legs or sometimes the thighs. And people often find them very unsightly. They're extremely common. And usually it's a result of the veins not flowing in the correct direction. The veins should flow, the blood should flow up the leg towards the heart. But if the veins are faulty, then the blood flows down the leg, and this can lead to these bulgy, unsightly, and often painful veins. So varicose veins are very common. Around a quarter of adults have varicose veins, and sometimes they don't cause any symptoms, but often they can be a really significant cause of distress, but also complications and problems. So many patients with varicose veins don't have any symptoms, and I certainly meet lots of patients who have had varicose veins for many years or decades without a problem. However, the older you get with long-standing varicose veins, they can cause a number of complications. The veins can cause symptoms, including itching, aching, heaviness, burning. Blood clots can form within the veins, which is called superficial vein thrombosis or thrombophlebitis, and this is a relatively common problem. The skin in the lower part of the leg can become discolored and can become quite itchy with eczema. And really, as a more advanced and extreme presentation, we do see patients with varicose veins who have developed ulcers on the legs. Now, ulcers are wounds on the legs or open sores that can be very painful, smelly, distressing. So not everyone develops these complications, but it's certainly a very, very common part of my practice. And I see a lot of patients with these sorts of problems. The most common symptoms are aching, heaviness, itchiness over the veins, and actually swelling of the lower leg is something that people often report. So a little bit of swelling is quite common, particularly if people spend a lot of time on their feet, but this can be much worse in people with varicose veins. The swelling often occurs towards the end of the day, but sometimes can occur all the time. And actually patients often wake up first thing in the morning with really quite swollen and painful legs. So these are the common symptoms, and then with more advanced problems, skin discoloration and other complications such as ulcers can also form. So in the last 15 or so years, there's been a really dramatic advance in the treatments available for varicose veins. Traditionally, we used to strip the veins out of the leg, which was a fairly major operation under general anesthetic and associated with significant complications, including blood clots and bruising. But we've seen a really impressive range of keyhole techniques that are now available, and most varicose vein operations can be performed using a keyhole technique. The commonest of these are what we call thermal techniques, so laser or radiofrequency ablation. And these are techniques to seal off the vein and to stop it feeding the large varicose veins. We also have novel techniques such as glue, a super glue technique to seal off the veins, and other techniques such as foam injections which seal off the veins. And also sometimes we do remove the very visible veins to get the best possible outcome. I think the very important message is that there isn't one technique only, and actually every single patient is unique, every single situation is individual, and so for each patient that's seen in the service, a unique decision-making process is followed, and it's quite common for an individual patient to have a number of different techniques on the same leg in order to get the best possible result. So itching is one of the very common symptoms related to varicose veins. So the itching can be directly over the veins, and the bulgy veins often have a feeling of burning or heat in the skin, and that can be quite itchy. But also the long-standing presence of varicose veins can actually cause eczema in the skin in the lower part of the leg. And this is an inflammatory condition in the skin, which leads to red, scaly skin, and this is immensely itchy. So these are the main reasons why veins can cause itching, but it's one of the most common symptoms that we see.